Welcome back to the Best PT Podcast. This is episode 9, talking about oncology. Starting with signs and symptoms of cancer, there's a nice mnemonic to remember it. The mnemonic is caution. So C, changes in bowel and bladder function. A sore that will not heal. U, unusual bleeding or discharges. T, thickening or lumps. I, indigestion problems. O, obvious change in a wart or mole. Or N, a nagging cough. Tissue and tumor classifications. Cancers of the epithelium, so the skin, internal cavities, and mucous membranes. We have carcinomas and adenocarcinomas. Pigmented cells, so moles. We have malignant melanomas. Connective tissue, muscle, blood vessels, bone, cartilage, fat, smooth muscles. We have sarcomas, fibrosarcomas, liposarcomas, chondrosarcomas, osteosarcomas, hemangiosarcomas, and leiomyosarcomas, as well as rhabdomyosarcomas. Nerve tissue, so brains, nerves, spinal cord, and retina. We have astrocytomas, gliomas, neuroblastomas, and retinoblastomas. Lymph tissue, so lymph nodes in the spleen, we have lymphomas. Blood tissue, bone marrow and plasma cells, we have leukemia and multiple myeloma. The National Cancer Institute staging system, stage 0, early malignancy, cancer only present in a single layer of cells. Stage 1, malignancy is limited to the tissue of origin. There is no lymph node involvement or metastasis. Stage 2, malignancy has spread to adjacent tissue. Lymph nodes may or may not be involved and show micrometastasis. Stage 3, malignancy has spread to adjacent tissue. Metastatic lymph node involvement is high. And stage 4, malignancy has metastasized beyond the primary site. Oncology pathologies. Brain cancers are caused by primary tumor of the astrocytes, meninges, or neurons. They can be metastatic from another region. Signs and symptoms include headache, seizures, increased intracranial pressure, cognitive and emotional impairments, and decreased sensory motor function. Treatment is surgical resection and radiation. Breast cancer, the cause is usually an adenocarcinoma. It's the second leading cause of cancer death in women. Signs and symptoms include a lump in the breast that is usually non-painful, discharge from the nipples, and changes in breast shape. Treatment involves surgery, radiation, chemotherapy, and hormone therapy. Cervical cancer. The cause is cancer on the surface of the cervix. Diagnosis is by pap smear. The usual cause is human papillomavirus or HPV. Signs and symptoms include abnormal bleeding, pelvis and low back pain, impaired bowel and bladder function. Treatment involves laser therapy, excision, cryotherapy, or hysterectomy. Colorectal cancer. The cause is 15% of all cancer deaths due to a high-fat, low-fiber diet or the Western diet. Signs and symptoms include bright red bleeding from the rectum, fatigue, weight loss, and anemia. Treatment involves surgical resection, possibly bowel resection, radiation, chemotherapy, and colostomy. Lung cancer is the number one cause of all cancer deaths, and 77% of lung cancers are linked to smoking. Signs and symptoms include a harsh cough, sputum with cough, dyspnea, and chest pain. Treatment is a poor prognosis. Lung cancer has a 14% 5-year survival rate. Surgical resection of lung tissue is highly indicated. Lymphomas. The cause can be Hodgkin's or non-Hodgkin's. The cause is usually from Epstein-Barr virus, drug abuse, exposure to cigarette smoke, or car exhaust. Signs and symptoms are often a painless lump in a lymph node. Treatment involves chemotherapy, radiation, stem cell transplant, and it has a high cure rate. Pancreatic cancer. The cause is usually tobacco use, gender, or age. Pancreatic cancer has a high mortality rate. Signs and symptoms involve weight loss, jaundice, and epigastric pain. Treatment. The mortality rate is almost 100%, so most treatments are palliative in nature. Basal cell carcinomas. The cause is sun exposure. Signs and symptoms include open sores that bleed or crust lasting 3 or more weeks in duration, as well as shiny pink bumps on the skin. Treatment involves surgical excision of the cancer cells. Malignant melanoma. The cause is usually a history of blistering sunburns. Signs and symptoms include keratic or scaly lesions, asymmetrical moles. Treatment. This cancer is 100% curable with early diagnosis and surgical excision. Moving on to specific pediatric oncology, astrocytoma. accounts for 50% of all pediatric brain tumors. Signs and symptoms can be cerebellar or supratentorial in nature. Cerebellar involves clumsiness, ataxia, headache, personality changes, and vomiting. Supratentorial involves headache, seizures, personality changes, visual impairments, and vomiting. Treatment involves surgical resection, which offers an 80 to 90% cure rate. Leukemia is a cancer of the leukocytes in the blood. Signs and symptoms include a leukocyte count over 500,000. Treatment in 90% of patients with ALL achieve complete remission, and 70 to 80% of AML patients achieve complete remission. Neuroblastomas, the cause. This is the most malignant cancer in children, with abdominal masses, personality changes, anemia, sweating, pain, and diarrhea. Treatment involves surgical resection, chemotherapy, radiation. Neuroblastomas are unique in that spontaneous cancer regression can occur with no treatment. Osteogenic sarcomas are the most common bone cancer in children. Signs and symptoms include a bone mass, rapid metastasis, and pain. Treatment usually involves amputation via proximal resection, chemotherapy, and for this type of cancer, radiation is not effective. Wilms tumor is an adenomyosarcoma of the kidney. Signs and symptoms include an abdominal mass, pain, blood in the urine, fever, nausea, and vomiting. Treatment involves kidney resection, the medicine dactomycin, with the 5-year cure rate being 75%. Oncology treatments: surgery, radiation, either ionizing or particle, chemotherapy involving alkylating agents, anti-metabolite agents, steroid hormones, plant alkaloids, interferons, or anti-tumor antibiotics. Biotherapy or immune therapy involves interferons, interleukin-2, bone marrow transplant, stem cell transplant, monoclonal antibodies, or hormone therapy in order to strengthen the body's biological response to cancer. Anti-angiogenic therapy suppresses blood supply formation, which is very successful against multiple myeloma. Pharmacological treatment involves hormone replacement or suppression in order to prevent cancer from using hormones to grow. And palliative therapy focuses on symptom management, pain management, and emotional or spiritual support. And finally, oncological pharmacology. Alkylating agents bind DNA strands together to prevent the replication, with the purpose being the halting of cancerous reproduction. Side effects are minimal compared to a diagnosis of cancer. PT implications: these patients may have fatigue, GI stress, or pain. Examples include Busaflex and Mustargin. Anti-metabolite agents impair biosynthesis of DNA and RNA. The purpose is to form a non-functional genetic product that cancer cells fail to replicate. Again, side effects are minimal compared to a diagnosis of cancer. PT implications include fatigue, GI distress, and pain. Examples include Adrucil and Trexol. Antibiotics interfere with cellular division in order to reduce malignancy replication rates. Side effects minimal compared to cancer diagnosis. PT implications: fatigue, GI distress, pain. Examples: mithrasin, cosmogen, and andromycin. Plant alkaloid agents are mitosis inhibitors that inhibit cell mitosis, with the purpose being the limiting of cancer cell growth. Side effects minimal compared to cancer diagnosis. PT implications: again, fatigue, GI distress, and pain. Examples include Taxol and Oncoven. Hormones suppress cancer growth as an adjunct therapy. Side effects are minimal compared to cancer diagnosis. PT implications: fatigue, GI distress, and pain. Examples: Nolvadex, Lupron, and Casodex. Biological response modifiers facilitate patients' immune response to cancer, with the purpose being the enhancing of a body's natural reaction to cancer. Again, side effects are minimal compared to cancer diagnosis, and PT should look out for fatigue, GI distress, and pain. Examples include Proleukin and Avastin. And finally, heavy metals inhibit DNA translation, with the purpose being the limiting of cancer growth. Side effects minimal compared to cancer diagnosis. PT implications: fatigue, GI distress, and pain. Examples include platinol and paraplatin. That's it for episode 9, talking about oncology. Episode 10 will talk about psychological disorders. As always, the outline will be in the show notes. Thanks for joining.